So once a person is exposed to a chemical, it enters their bloodstream and it gets metabolized and excreted either through the urine or through their stool. It could also get stored in body tissue or body organs, including bone or fat tissue. And so the way that the chemical is processed through the body depends on the specific chemical of concern, the level of exposure, and the routes of exposure. So both short and long-term health effects are possible. And we think about short-term health effects. The most common ones can be irritant. And that includes eye, ear, nose, throat irritation, headaches. What we see most commonly as environmental pediatricians when a family calls us with concerns about an exposure in the home or the school is the stress that that family feels from not knowing what it means for their family in terms of long-term health. Evidence is building on the contribution of environmental exposures to a wide range of chronic conditions, and those include things like asthma, obesity, diabetes, heart disease, neurodevelopmental conditions, and even cancer. So to understand the human health impacts of a range of exposures, oftentimes a team of experts is put together that'll perform a risk assessment. And the simplest way to explain a risk assessment is that this team, which it can include risk assessors and toxicologists and scientists and physicians and others, will come together and take the best available evidence. And they'll use the existing animal studies and human studies and essentially come up with a mathematical modeling that will help understand what a specific chemical means at those levels for a specific population. And they'll essentially come up with a determination of what the risks are to this special population, given sort of the routes of exposure, the specific chemical of concern, and a number of uncertainty factors based on the limited evidence that may be available.